Good afternoon. This is the 2-minute warning. Please press 1 to ask a question.
Well, good afternoon, everyone, and thank you for joining today's update on COVID-19 in North Carolina. As of today, we have 297,442 cases, 2,582 new cases reported since yesterday, 1,230 people in the hospital, and sadly, 4,660 people who have died. As the number of people lost to COVID increases and we draw closer to the holiday season, I know many North Carolinians are grieving right now, and I continue to think about them as we battle this virus. Today, Dr. Mandy Cohen, our Secretary of the Department of Health and Human Services, will present our state's key COVID-19 metrics. As she will outline, our trends have avoided spikes, but they remain stubbornly high, and that's troubling. Other states have experienced spikes that have jumped quickly on them and their hospitals, causing more sickness and death. To avoid that, we need to focus on bringing our numbers down. We know how to do it. Wear a mask, wash your hands, wait 6 feet apart. Thanks to the North Carolinians who are doing those things. If more of us will join, it can help our economy recover and save lives. Right now, I'd like to ask Dr. Cohen to present our data.
Thank you, Governor. Before we dive into the data, I want to give a shout out to all of the nurse practitioners out there, starting with my mom. It's National Nurse Practitioner Week, and our nurse practitioners are carrying a heavy weight on their shoulders as they've worked tirelessly to serve on the front lines of this pandemic. Let's honor our nurse practitioners by living up to the message they are sharing this year. COVID-19 may have started this fight, but together we will win it. Today, my reason for getting behind the mask is nurses. I love you, Mom. I also want to share some good news. While it is still early, we learned yesterday that one of the vaccines being developed has shown promising results. And the Food and Drug Administration granted emergency use authorization for a new antibody treatment for people at risk for developing severe COVID-19 disease. While the supply of this treatment will be limited at first, I'm very pleased with the progress of our scientific community and what they're doing to fight COVID. Okay, now let's dive into the data. As a reminder, every week we look at a combination of trend metrics: COVID-like syndromic cases, new cases, positive tests as a percentage of total tests, and hospitalizations. We also look at testing and tracing capacity along with supplies for PPE. In our first graph, we look at people who've come to the emergency department with COVID-like symptoms. This is our earliest detection mechanism. The yellow line shows that the trend is going down but remains elevated. Next, we look at new cases. This first graph shows you the trajectory of new cases each day since we had our first case back in March. You can see the yellow line has gone up considerably in the last month, and we are experiencing a new peak. If we narrow in on the trajectory of cases from early September through today, you can see a clear picture of what's been happening. Overall, our cases are trending up, and this is concerning, particularly as we head into the holidays. Next, we'll look at the percent of tests that are positive. This graph also goes back to the beginning of September, and if you look at this yellow line, our percent of positive tests has remained fairly level since mid-October. However, it is now closer to 7% rather than the 5% we had been seeing back in September. We want this metric at 5% or below. On our next graph, we look at day-over-day hospitalizations. This graph also starts in early September, and the number has been relatively stable since mid-October, but you can see our hospitalizations are up since September, and overall are too high as we head into the winter months when hospitals have stretched capacity even in non-COVID years. It's a reminder, if you haven't gotten your flu shot, please do that as soon as possible. Okay, here's where we are. Surveillance data has been going down, but still above our baseline. It gets a yellow line. North Carolina's trajectory of cases is up, and it gets a red X. North Carolina's trajectory in percent of tests returning positive is level, but it's running higher than it was in September. This gets a yellow line. And North Carolina's trajectory of hospitalizations is high, but level. We still have capacity. This also gets a yellow line. Now to the capacity indicators. Our testing capacity is good. We're doing a high number of tests and making screening tests available ahead of Thanksgiving. This gets an upward arrow. On contact tracing, there have been more than 800 notifications of possible exposure to COVID-19 through Slow COVID NC. You can join the more than 345,000 people who have downloaded Slow COVID NC from Apple or Google Play Store. This metric gets a sideways arrow. Our PPE supplies remain stable, and we continue to distribute PPE across the state. This indicator also gets a sideways arrow. Bottom line, we are on shaky ground as we head into Thanksgiving. The safest thing we can do for our loved ones is to limit travel and to avoid getting together in person, especially indoors. I know that's more easily said than done after so much time apart from our friends and family. So if you're going to travel or get together, plan ahead to reduce the risk to your family and friends. Think about getting a COVID-19 test 3 or 4 days ahead of time. A test can help you know if you have COVID-19, even if you have not had symptoms. If you do test positive for COVID, stay home and isolate. Because a test can miss some infections, and a negative test only gives you information for that moment in time, it's not a free pass. So you still need to wear your mask and practice all the 3 W's, including keeping 6 feet apart from each other and washing your hands often. Tests are available at state-funded community testing events. Other sites may offer tests for this purpose as well, so call ahead to find out. You can go to Find My Testing Place for a list of all community testing events and testing sites. Detailed guidance for traveling and gathering during the holidays is available on our website, including guidance for Black Friday shopping. Let's all keep our friends and family and loved ones safe this holiday season. Remember, it's not how well you know someone when it comes to wearing a mask. If they don't live with you, get behind the mask. Thank you.
Thank you, Dr. Cohen, and for your leadership. As you can see, these numbers are too high. Considering our trends and cooler weather driving events indoors, North Carolina will remain paused in our current Phase 3, and we will adjust our indoor gathering limit down from 25 to 10 people. The science shows that the transmission of this virus is much greater indoors, and the more people who are gathered, the easier this virus can spread. We saw increasing spread from social gatherings in October. This reduction in our indoor gathering limit aims to slow the spread and bring down our numbers. It also sends a serious signal to families, friends, and neighbors across our state. Success in slowing the spread will help our businesses. In addition, we've been providing some direct help, and this week there will be some additional assistance for restaurants. Starting Thursday, full-service restaurants seeking help with rent payments or mortgage interest may apply to the North Carolina Department of Commerce for up to $20,000. As Dr. Cohen talked about, Thanksgiving is just 2 weeks away, and many North Carolinians are focused on how to celebrate the holiday amid the pandemic. There will be the usual concerns about who's carving the turkey and whether you're going to talk about politics. But we need everyone focused on how to keep safe this holiday season. And I want North Carolinians to keep something else in mind as plans come together. This pandemic will end. A vaccine is in the final stages of development, and the FDA has authorized a promising new treatment. Hope is on the horizon. This pandemic will not last forever. As frustrating and painful as it is, we must keep fighting a little while longer. We don't want to let the last 8 months of sacrifices go to the waste by dropping our guard or ignoring safety measures during family gatherings. We've come too far to lose our focus now. We don't want a spike in cases and deaths that will also hurt our economy. And even though this means changes to long-standing holiday traditions for many of us, take comfort in the fact that there is light at the end of the tunnel. With our continued dedication, by next Thanksgiving or even sooner, this pandemic can be behind us. We can put the sickness and the economic hurt in the rearview mirror if we pull together. That takes everybody committing to a safe holiday, even if it means changes this year. Reduce the invite list. Space out your tables. Get a COVID test before the event. Or better yet, connect virtually. I know North Carolinians are creative and will find amazing ways to celebrate the holidays while still keeping our communities safe. Find a way that works for your family, and know that your sacrifice is helping all of our state. Also with me today is the Secretary of Public Safety, Eric Hooks, our Emergency Management Director, Mike Sprayberry. Monica McGee and Brian Tipton are our sign language interpreters. And behind the scenes, Jasmine Mativier and Javier Castillo are our Spanish language interpreters. We can now hear from our media, and if you'll state your name and your organization, we'll take the first question.
Our first question is from Sharon Van Zwieten with Spectrum News.
Thank you, Governor. This is Sharon Van Zwieten with Spectrum News 1. How will the state enforce those restaurant restrictions?
Well, we already have restaurant restrictions in place, and most restaurants in North Carolina are doing a pretty good job. They're at 50% capacity. We want them to wear masks. I know that Dr. Cohen has talked to local health departments and local officials about enforcing those safeguards that we have in place for people. So we hope that that will continue. This new order will not change what we are doing. You know, we always want to be going forward, but we're not going to go forward if we don't think the science and the data shows that we should. And the health experts who keep looking at this say we still need to abide by the safeguards that we have. We know that a lot of people are going to be moving indoors, and I know a lot of communities have had outdoor events. We worry about them moving them indoors, and it's why we've lowered the mass gathering limit as part of the next executive order. And Dr. Cohen, I don't know if you have any other thoughts about that. Next question, please.
Our next question is from Dawn Vaughn with the News and Observer.
Hi, Dawn Vaughn with the News and Observer. With us being kind of at the end of the line with phase 3, I know you've been asked versions of this before, but is there a phase 4, or will it be the way that other countries are doing with tiers of adding restrictions? And will there be changes like to the alcohol curfew? And then regarding the holidays and travel, have you considered asking people from states with high rates to quarantine?
Well, thanks for that. We believe in continuing to use the metrics that we have in place to determine where North Carolina is. And first, we need to make a point that we have not experienced the spikes that a lot of other states have, where their hospitals have become overwhelmed, where there is much more sickness and deaths. So we're doing some things right. All of those potential future safeguards are on the table for us to examine, and we certainly want to keep on the table easing the safeguards that we have in place as we move forward. But we're entering, I think, a very dangerous and potentially uncertain time here in the holidays. As it gets colder, the virus wants to be more active indoors. So we're ratcheting up the prevention efforts out there to let people know that this is very serious. Dr. Cohen, you may want to weigh in on that.
Hi, Dawn. The other piece I would add is around the holidays and travel. You're going to see a lot from us in terms of communicating about wearing a mask and about appropriate social distancing. And of course, we want folks to be abiding by this new lower mass gathering limit of no more than 10 people. But you're going to hear a lot more in communication. And in addition, we're asking folks to consider getting a test ahead of their travel or ahead of getting together. So 3 or 4 days ahead of Thanksgiving to consider getting a test. You can find those tests at community testing sites where they're free, or at other sites. There are about 600 or so sites across the state that are offering testing. So we think the combination of testing and this continued increase communication, we want folks to know that North Carolina is a place that, one, we're all wearing masks to protect each other. We're going to take all the precautions and follow our Thanksgiving guidance and work together to make sure that we are following this new lower mass gathering limit. Thank you.
Next question, please.
Follow-up, Dawn Vaughn, News and Observer.
Hi, thanks for the follow-up. Given we're 2 weeks out of Thanksgiving travel, though, is that a definite no with any quarantining? And then related to that, have you thought about how to do contact tracing with so much travel? And are there parts of the state or certain counties where contact tracing isn't viable because of the amount of viral spread already?
Well, first, there's not been a decision to enact any type of quarantining or travel bans at one point, and I think Dr. Cohen's explanation of the safeguards that we have in place at this point are where we want to be. I think that contact tracing continues to go on, but the level of community spread makes it much more difficult. And I'll let Dr. Cohen talk about how that specifically could apply to someone coming in from out of state.
Thanks, Dawn. And before I take off my mask, you may see it says Slow COVID NC. And I think this is going to be an important part of our strategy here to remind folks when they are traveling or coming into our state to download Slow COVID NC onto their phone. Again, it tracks none of your personal information, is completely free, and it uses its Bluetooth technology to figure out if you are close by to someone. And again, I think it will be another important tool in our toolbox to do the kind of contact tracing that you were speaking of, Dawn, and already over 800 folks have been notified through that app that they may have been exposed to COVID-19. So that will be an important tool, particularly with new people coming into our state. You'll see more messages from us around Slow COVID NC and making sure to download that. So we've added that to our guidance. So if you're having folks come from out of state, they absolutely should download that app while they're here in our state.
Next question, please.
Our next question is from Ashley Talley with WRAL.
Hi, thank you for taking my question. I'm wondering, other than family gatherings for the upcoming holidays, what sort of gatherings are you really targeting with this move back to 10, and will this affect churches? And do you think this is really going to make a difference, or are people just kind of worn out with, all of the COVID precautions in place already?
We are targeting and wanting people to know at social community gatherings and family gatherings that this is where we have seen the clusters, particularly in October. This is where we've seen a large part of the outbreaks. So part of this lowering of the 10 to from 25 to 10 indoors is to send a signal to those groups that this is a problem. People tend to let their guard down when they are with people that they know, or even people who are family. But as we've said time and again, that doesn't mean they don't have COVID-19 and aren't showing symptoms. So if you don't live with somebody, and if you're around with somebody, you should wear the mask and social distance. And sending this strong signal to all of these social gatherings, family gatherings, community gatherings, that you really need to narrow the focus when you have them, and that you need to be wearing the mask and social distancing if you do have them, is something that we consider is critical. And yes, people are tired and frustrated with all of this. But one of the points of this today is we've got a vaccine that is coming. We know that it's going to take a while for the manufacturing and the distribution process and the final approval. We don't even have final approval from the FDA. But we have another treatment that has shown positive results. And I have faith in American ingenuity, and I have faith that our medical and health researchers, a lot of them right here in North Carolina, are going to find ways to curb this virus. And that is something that we can see out there. So until that time, let's make more effort to do the things that we need to do. And I am so grateful to the people of North Carolina who have had to change their lives, change the way they do things, wear the mask, social distance, try to make decisions on what they will and won't let their children do, have to sacrifice visits with people that you love very much. These are things that are really hard for North Carolinians. But I think that now that we can see the light at the end of the tunnel, now that we are getting closer to coming out of this thing, let's don't waste all the time. Let's don't have a major spike here in North Carolina and start overwhelming our hospitals and having to set up outside hospitals and having people needlessly die when we know what we can do. And those who haven't been doing this, let's join in and get it done as a state so that we can begin to ease safeguards and so that we can begin to turn our lives back to normal. You can talk about the new normal all you want, but we know this is not normal with what people have been going through, but it has been necessary in order to save lives, and we have saved lives in North Carolina. So we just got a lot of work to do ahead, and I think that this is a strong signal to particularly the community, family groups, that we need to be careful, particularly as the weather gets colder and we enter into holiday season. Do you want to comment on that? Next question, please.
Follow-up, Ashley Talley, WRAL.
Sorry, thank you so much. It makes a lot of sense that that's where our clusters are coming from, so that's what you're targeting. My follow-up question is, does this affect church or religious gatherings?
It does not. They are excluded from this as some of the other exclusions that you can see from the executive order, but the principle still applies, and there's been a lot of work by the Department of Health and Human Services with faith leaders about the fact that we really need to be careful that if you're having in-person services, you really need to take significant steps to protect people. We're encouraging people to continue still having virtual services, and I know a lot of churches still are and have been done very limited in their back to in-person. But I'll let Dr. Cohen talk about that because I know that they have touched base with a lot of faith leaders about trying to do things they know that will protect the congregation.
Hi, Ashley. Governor's exactly right. So while churches and other religious settings may be exempt from the executive orders, we know that folks are working hard to protect their communities. We have a faith toolkit that we have worked with the faith community to create and have now been disseminating. We have a team of folks who are making phone calls every day to faith leaders across the state, and I've really been appreciative of how collaborative everyone has been. And I think there are ways for folks to have religious services, but doing it in a safe way, whether that's virtually, doing them outside, doing them in much smaller groups, making sure to social distance, wearing masks all the time. And so just like we would wear a seatbelt to protect us as we drive to church or to synagogue, we wear a mask when we get there. So there are ways we can still make sure that we are connected as communities, but protect each other while we're doing that. Thanks.
Thank you. Next question, please.
Our next question is from Tess Bargever with Fox 8.
Good afternoon, Tess Bargever, Fox 8. I have two questions for Dr. Cohen. First is about the Slow COVID NC app. I know you mentioned the amount of downloads and notifications, but I also know that only about 113 people have notified others of a positive result. I was wondering if people were reluctant to share those results and if the state was addressing this. My second question was about Triad hospitals, but if you'd prefer, I can wait on that.
With Slow COVID NC, we have about, I think I said 345,000 people who have downloaded it and about 800 who have been notified so far related to it. I think we think that's probably proportional to the kinds of cases that we're seeing in terms of the whole population of 10 million people here in North Carolina. The app works better when we all download it. And so that's our message, particularly for folks who might be traveling from out of state. But right here in North Carolina, go right now to your Google or Apple store. It's completely free, takes no personal identifiable information. It doesn't track you. It uses Bluetooth, real simple. So the more people that use it, the more effective it is as a tool. So we haven't heard about reluctance to use it because it's completely anonymous. I just think more people need to do that. I'm happy to answer questions about hospitals.
Sure. I know that Triad hospitals are reporting record high numbers of hospitalizations. Are you working with these hospitals right now to make sure that they will have enough space for people?
Thanks for that question. We are watching hospital capacity very closely, as the governor has said. It is very much something we watch multiple times a day, if not every single day, to make sure that we understand where hospitals may be stretched to their capacity. We know some of our smaller hospitals already are feeling stretched because of COVID and not COVID. As I said earlier, hospitals as we go into cooler months actually already experience a stretching of their capacity on non-COVID years. So we're very much looking at capacity across our state. I want to commend the hospitals for really working collaboratively together. We see some of our bigger hospital systems taking in COVID patients or taking in very ill patients from some of our smaller hospitals. We move folks around, and we're working together really well. So I want to commend the hospitals for their transparency, for their collaboration together, and we're going to continue to do that and watch that very closely. We have a team of people who monitor that all the time, and we're going to work hard with those hospitals. But we need to do our part. Every North Carolina needs to do their part so that folks aren't finding themselves at the doorstep of their local hospital. So we want to keep everyone safe and healthy. That's why we're going to make sure to get behind the mask. Thanks.
Thank you. Next question, please.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Governor. This is Richard Craver with the Winston-Salem Journal. This question is actually for Secretary Cohen. We've been following closely the issue involving Cardinal Innovations, and at least 5 counties now whose county commissioners have voted to want to leave Cardinal to go to another behavioral health MCO. And I was wanting to find out where things stand in terms of the Secretary addressing those request and what kind of evaluation or measuring stick she's using to determine whether they should be able to go or not.
Sure. Thanks, Richard, for that question. And yes, we have received those letters. In a number of cases, the counties have indicated some concerns related to Cardinal and the services that they're providing. We take those concerns very seriously. We have asked Cardinal for corrective action, which they have outlined in a plan. Our role as regulators is to make sure that that plan turns into action and that they follow through with that. And if they don't, that we hold them financially accountable for that. So I believe that they are making the corrective steps forward in order to do that. We will review the county's requests for disengagement and re-engagement with a different LME MCO. There's an extensive process with that our department will go through to make sure that we have the right information. Again, our role is to make sure that Cardinal is living up to its obligations and delivering the services for the folks in North Carolina. I believe the plan that they've outlined gets to those concerns, but now we have to make sure that those get implemented. Thanks.
Next question, please.
Follow-up, Richard Craver, Winston-Salem Journal.
Yes, Secretary Cohen, I was going to ask a follow-up question. Do you have a timetable for when you might be making a decision on any of these requests? And do you have any concerns that this may be systematic, that the other 6 MCOs may be having similar issues, or is this something that you're determining may be specific to Cardinal?
Well, thanks for that. There is a defined process that folks need to go through with submitting paperwork and an evaluation from my team. So it is not an immediate process, but we'll step through that over the next coming weeks here as we go through. I do want to remind folks that as we think about delivering mental health services for the state of North Carolina, it is a very challenging job, particularly in a state that has not expanded Medicaid. We have underfunded our mental health system and then asked folks to essentially provide coverage for everybody. And that's an impossible task. What we need to do is actually expand Medicaid, give folks access to ongoing insurance coverage for both their physical and mental health needs, and make sure that we hold accountable those entities that are meant to deliver those services. So we have some work to do in North Carolina to strengthen our mental health system overall, and so we will continue to do that work, but I think key to that is expanding Medicaid. Thank you.
Amen. Next question.
Our next question is from Michael Hyland with CBS 17.
Hi, this is Michael Hyland from CBS 17. I wanted to clarify, in reading through the latest executive order and the frequently asked questions, can you tell us what impacts, if any, the decision on the indoor mass gathering limit has on schools, either K through 12 or in colleges? And should this decision inform the decisions local school boards are making now about whether to bring more kids back into classrooms?
So first, it would not affect schools or universities, and it is more targeted to the social, family, community gatherings that we have seen increase spread. But the fact of the matter is that the numbers are higher across the state. We encourage schools to look at their local numbers to see how things are going in their communities. And I might want to ask Dr. Cohen to step up to see how she thinks that they should consider this reduction in the gathering limits.
Yes, as the governor said, the schools, as K-12 as well as higher ed, are exempt from the executive orders. We continue to have a number of protocols in place for our K-12 schools. We also continue to post information about outbreaks or clusters in our schools, and what we've seen is actually a very low level of viral spread there, which is good. But we need to keep up that work, making sure that we are being vigilant about those protocols, wearing masks all the time, keeping social distance, doing the screening and cleaning protocols, and so we'll keep evaluating that. Again, we've said many times that having our kids back in school is a top priority, and we want to make sure that we are appropriately protecting our students and our teachers while are aiming for getting our kids back in the classroom. I think it is why the governor is doing the hard work today of trying to help everyone understand why we need to slow the spread of this virus, when we all work together, it's so our kids can go to school. It's so that they can go to school in person and keep this virus level low, protect our students, protect our teachers as we go through. Thank you.
Next question, please.
Our next question is from Brian Anderson with the Associated Press.
Hi, Governor. Hi, Dr. Cohen. Thanks for the time. Brian Anderson here with the EP. I have a very simple question for each of you, and would appreciate just a direct yes or no, so I don't have to ask it in the follow-up. I know the two of you are committed to serving the people of North Carolina and are focused on that. But having said that on your behalf, I'm pleading for a straight answer, yes or no. Are you considering, or are you open to considering, a position in a Joe Biden administration?
No for me. But let me just say, on behalf of Dr. Cohen, she is doing an amazing job here. We are fortunate that she agreed to come and join my administration in 2017. But I think she is keeping her head down and doing what she needs to do to move our state forward. And I think that part of the reason why she would be considered, and I know that her name's all over the news, one of the reasons she would be considered is because of the fact that North Carolina has done well and has done the things that we need to do to create a positive response. So anybody would be fortunate to have Dr. Cohen, and of course, I want her right here. You need to say anything? She doesn't need to say anything, but she says. So next question, please.
Our next question and our final question is from Caroline Hicks with WBTV.
My question was related to that last one. I was going to ask Dr. Cohen whether she would consider a spot in the Biden administration, and if she could confirm whether this is the case and where she is in that process.
Sure.
Well, as the governor said, I think it's flattering to see both North Carolina and the recognition of the work of the Department of Health and Human Services in the national context. It's been an incredible effort by the team here in North Carolina, and I think everyone should recognize that. You know, I am focused here on making sure the folks in North Carolina stay safe, particularly over the holidays, and I'm going to keep focused on that. Thank you.
Are we good? Are we good? Oh, okay. Thank you all very much for joining us today, and stay safe, everyone.